Welcome,
Hey,
everyone, to the
welcome,
Hippocratic
welcome.
Collective Rank List webinar. We have such an incredible crew here. I'd love to go around and let everyone introduce themselves first before we get started.
I can get started. I'm Laura Vater. I'm a medical oncologist. I focus on GI oncology. So I take care of patients with pancreatic, colorectal, all sorts of other GI cancers. I'm also really interested in narrative medicine, writing, and clinician well-being. And so glad you're here.
Hi, I'm Maheetha. I am a fourth year urology resident, and I am really, really excited to be here. I'm in my research year, so this is even extra special.
I can go next. I'm Andrea. I am a dermatology resident in my PGY 3 year, so like second year of dermatology residency. And I'm interested in pursuing a fellowship in pediatric dermatology. I'm also interested in narrative medicine, and I think like quality of life and with dermatology issues, and so that kind of is like my interest and niche. But overall, excited to be here today and happy to answer any questions that you all have, and honored to be here with this amazing crew.
And then I guess that's me last. I'm Liz Malphrus. I'm a plastics PGY 6. So my last year of training in Philadelphia in plastic surgery. And I just last weekend we had our interview day, which was a nice like full circle moment of like being on the other side with my co-residents. We all got to run our own room and interview candidates. And so anyway, I've been thinking a lot about this and excited to chat more.
Amazing. Thank you guys so much. We have such an incredible crew here tonight. My name is Frances May. I'm an ENT by training, but I'm just the moderator for tonight. There's so much wisdom in this virtual room, and so we'll just go ahead and hop right into it. We had a couple people writing questions ahead of time who said that they wanted to watch the recording and things like that. So, guys, thank you for being here. Please feel free to drop questions into the chat as we start going, but we'll kick it off with this interesting question, which is, when you look back on your rank list, what is one assumption that you made that turned out to not be correct once you went into training and experienced it yourself?
This is kind of a basic one, but I definitely made my rank list assuming that I was not going to have any chance of getting at my top spot, and then I did. So I know it's like I got very lucky, but I do think that advice, I took that advice that everyone gives. That's probably the most important thing to hear, which is you need to make your rank list based on where you want to be, irrespective of whether you think you have a chance, because sometimes things work out.
I want to piggyback on the working out part of it because I made my rank list. I ranked my programs based on um quality of what I think the research was available at the time when I asked all these questions. And during the interview, I asked like, oh, like if I wanted to do this kind of research, or is there somebody already doing it? And I ranked programs based on the research that was already existing. And so that to me seemed like it was perfect infrastructure to then do what I wanted. But um, I matched to a place that was not necessarily in my top three programs. And I was thinking, oh, I don't know if like the kind of research I want to do is here. However, it's all about the path that you make for yourself, right? Like there will always be a way to do the kind of work you want to do. You just have to find it. And I've actually been really, really happy here with the kinds of opportunities and collaborations that have been available. So I just wanted to throw that out there that, you know, you can always do what you want to do. It's just about how you go about doing it.
I definitely agree with that. I think it's really hard to fully predict what your experience is going to be like and the things that are really going to impact you on a day-to-day basis. I was just trying to pull up my like rank list, and like I have all these categories of things I ranked, which I'm happy about to talk about later too. But I think as Maheetha said, like it's really what you make of it, and no matter what, you're going to get a you're going to learn what you need to learn to be whatever specialty you're going to be. So I think just paying attention and knowing what like your priorities are is really important. Um, I can't think of anything specific that I was really surprised by because I felt like I kind of did a research ahead of time to know about the program. I guess I think maybe one thing is actually like my top three programs were all fairly like geographically close together, and I've been pleasantly surprised by the fact that I feel like the programs all interact a lot, like the attendings interact a lot. We actually have a lot of like conferences and stuff together. So it's kind of funny that I feel like I end up seeing a lot of those people
anyways, that were all like in those top three ones. So that's kind of fun that I didn't really expect that I would still be interacting with them, which I think has been helpful because I'm still looking at those places for fellowships. So I'm like, wow, luckily I ended up kind of in a way that they all kind of intersect and I can still interact with those like other places, even though they're not all in the same city.
I love that. What really stands out to me is that everything that you guys shared is kind of interestingly a message of things do have a way of working out, which I think is reassuring to hear. And I've seen that a lot over the years. It's so funny because I've seen in the past where people match at a program that might not even have been their number one on their physical list. Maybe it was 3, 4, 5, 6. And then looking back at the end of their residency, they say, this was the best possible experience I could imagine. Knowing everything I know now, that's the one that I would have picked. Glad that I got my number 6 slot.
That is me. That is me.
That's awesome. I hope that even just thinking that way, kind of that perspective, that it allays some very real anxiety that people have surrounding the rank list and things like that. Laura, did you have anything to add before we hop on to the next question?
Yes, I will. I would just say that I'm 3 years now out of fellowship. And I think that when you're in it, it feels so overwhelming. I have to choose the right program. Everything hinges on this. Do I match where I want to be? I think now on the other side of it, of course, now I interview both residents and fellows coming into HEMONC and all of this, is that so much program matters, but so much of being successful in training is really self-initiative, getting to know people, seeking out opportunities, and sometimes that's at national conferences, sometimes that's within your own program. And so I think one thing I didn't really know going in, I thought your training program was kind of the end all be all, and it's great to have a great match in terms of a program, but that there is so much that happens beyond the level of a training program that leads to success.
I just thought of one more thing as well. I don't know if everybody had this experience, but I remember that when I was like basically trying to rank my rotations, like as a incoming third year med student, everybody was like, oh, you got to put this one first and this one first, and you have to do it this way. And everybody was stressed about getting everything in the right order. And then it comes down to it, there's not really like a perfect order. Your rotations are going to work out. Like, it'd be ideal not to be like medicine surgery back to back, but for the most part, it's going to work out and there's not really like one perfect thing. So I think if you can remember how you felt then and that it all worked out, like kind of translating that forward, it can apply to this as well. Like as long as you are thoughtful about making your rank, it's totally okay if you don't end up like at your number 1 or 2 or even 3 program. And you just have to kind of figure out what can you do to make this the best experience for yourself.
Yeah, beautifully said. Thank you, Laura and Andrea. One thing that comes to mind for me, and again, I'm not even trying to be a negative Nelly, so please open your mind up here, which is just to share that the more that you can come from a place of acceptance and modifying the things that are totally under your control, which to Laura's point is you're always under your own control. Think of the serenity prayer and things like that. What I have also seen over the years is people matching at like their number one program. It's truly the culture, the program, the fit, the PD that they really wanted, and all their dreams come true and they get their number one. Okay, when they become a PGY2, that dream PD relocates and somebody new comes in and the culture changes and their life changes and kind of the milieu does. So again, it's just interesting, and it's important to know that there are some things we don't have control over. So hopefully that gives you more of a framework or perspective that's like, I'll ride the waves. There's always going to be stuff going in your favor and going against your favor. I love, we'll go ahead and hop into the first question from chat from Zoe. I apologize if I mispronounced that. So I would love to hear advice on sending letters of intent. I'm still not sure what my top is, but I feel a lot of pressure to decide and send a letter before rank lists are solidified. This is the $1 million question.
I would say that a letter of intent after interviews, and I'm assuming that this question is for after interviews. I think in my experience and from what I've heard from the people I talk to is that you have to be very specific as to why you are sending the letter of intent. I would 100% only send a letter of intent that says you are my number one to your one and only number one program. I would not send multiple number ones. And I actually sent letter of intents to 5 programs, but I only said to one of the programs that they were truly my number one. I think in hindsight, I probably could have really had a little bit more specifics in my letter of intent because they really, you have to have a good reason as to and they have to see a good reason as to why they should consider you a little bit extra. And so usually the things are family connection, partner connection, things that could really, really push you a little bit over the edge. If you have a huge update on like a very, very important, paper, or you have a score update. So you maybe didn't take step 2 before. I guess now that's different because in my time, step 1 was the major exam, but now step 1 is pass fail. But if you have a major exam update that could potentially change things, you have to maybe have that in your letter of intent. Because otherwise they really aren't going to kind of really care about your letter of intent. They're going to just go with what the list that they have. So you have to have something that is going to compel them to push you from, not being ranked to match to ranked to match. And usually those are like personal connections, family connections, really, really talking about a very specific program there that you have a lot of experience with. So it has to be something special and something specific, I would say.
Yeah, I agree with that. I think that if you don't know what your top is, then maybe don't pressure yourself to
Right.
feel like you have to decide one now, because the letter of intent, I think, is meant for like, I have this number one and I like need to be there, or like I absolutely know that I want to be there. So if you don't feel that way, that's okay, because that probably means you'll be happy at a lot of places, which is a really great place to be as well. So you have time to figure it out. I think if you don't know like number one, that's okay. And then like it would be disingenuous to yourself to try to force yourself to maybe pick one too early, because you might, like, when it gets closer, you still have a few weeks before you have to rank it. So if you don't really know what that is yet, then you might not want to force yourself into it. That's kind of what my thoughts would be. I sent one to my number one and that was the only one. Um I guess I didn't really think that you could send it to other ones, but I have heard other people say that you're highly ranked. I just didn't know that at the time. Nobody had told me that. So I just sent the one, but I agree. Like, if you're not 100% sure, like, this is the number one place I want to be, then I don't think it would be worth doing it, because you might end up regretting it.
Agree.
It may be a little different in plastics. I don't think letters of intent really have a big role for us. I think if anything, it's like, it's a small enough field that if you like really want to communicate to a program that they're your number one, that might take the form more of like you talk to your mentor or whoever, your chair at your program, and they talk to that person. But I think in reality, like, I think we get kind of hung up on this concept of like communicating after the interview, but really I think once the interview is done, it's kind of like probably fully baked. I think a lot of programs have their meeting immediately after. It's not like they're waiting weeks and weeks to actually have their meeting, unless, like, I don't know, most of ours don't have multiple interview days. So for me, I like, if you're in plastics, don't worry about this. Honestly, don't send one. Maybe talk to your mentors. That's really more important anyway.
Amazing. Laura?
Yeah, I agree with both Liz and Andrea, and probably Maheetha. I just couldn't hear you. And I think just being genuine. I think, setting a letter of intent if you truly want to be at that program, but not worrying about it too much if not. And I think, as Liz was saying, programs. Even I was in internal medicine and to hemonc, but even the program directors, they know each other. They go to the same conferences. I mean, it's good just to be genuine, and that just helps when you're walking into this process. And if you're unsure at this point, then I wouldn't worry too much about it.
That absolutely makes sense. I think great advice from everyone. And certainly from my ENT experience, I do think that there's a very real, especially during and pre-interview season, there's this sense and advice, which is don't get on people's radar in a bad way. I really remember, like, during COVID, when everything went virtual, people were trying to game the system, or they said, let me call a parent to call in a favor for me to show up in person at this department, because this is close to home, or I do have ties, like what Maheetha was speaking about, which is like, okay, I do have some like personal or family ties. And it's like that got some people on the radar in a negative way. So you don't want to be going outside the norms there. And I know that absolutely sending a letter of intent, maybe a couple letters of highly ranked, that's not going outside of these normal channels. But I just say that in case some of you guys are thinking about it. I would not show up. That is viewed very negatively.
Don't do that.
Yeah, we have to say it though, because people
Yeah, no,
will
you're
show
right, you're
up.
right.
Like I feel like one kid a year will just kind of pop up, and I get the excitement, I get the intention, but it becomes a
Don't do
PR issue.
that.
Okay, this is very interesting. We'll come back. We're just jumping around questions, but I think next most high yield is how to approach judging programs based on interview day experiences. It can be hard to get a true sense of the vibes.
One thing that I can just start things out since we just did this at my program, one thing that I think I always try to pay attention to is how the faculty and residents interact and how the residents interact with each other. Because I think the culture is how they're behaving among themselves. It actually has something to do with you. And I think if you can pay attention to, like, I would look out for, like, do these residents, like, is someone discovering that their resident has a kid and they didn't know about it? Like, they probably are not very close. Like, I heard that when I was there on one of these interviews, and I was like, I guess they don't hang out. Similarly, like, do the faculty and the residents like chat casually at the social, or is it like two separate factions? Both of those can work, but like that is information about, is this more of a collegial, like how hierarchical are we talking? So I think it's those like observations that can tell you the most, because again, it's like how people behave. It's not what they say.
I think it's always great when they give you opportunities to speak just with the residents and when the faculty are not there. And of course, many interviews are virtual. Has that been true for both everyone here? I mean, I interviewed in person, and most interviews now that I participate in when I'm interviewing people, they're all virtual. So I can understand how hard it must be to get a sense of what a program really is like virtually. But if you can have opportunities just with one-on-one residents, if you don't have that, you can ask that. Depending on your priorities, I think for me coming into both residency and fellowship, I was really curious about call structure and shift structure. And I had a 1-year-old daughter when I started intern year. And so I had kind of different needs, and I wanted to make sure that I had a program that really supported those needs. And so I was actually really bold. I actually asked every program in advance that I interviewed in person for a lactation room. And that was really telling to say, like, do you have a lactation room or not? And some didn't. And I was like, nursing in a random staff room that was supposed to be locked, and then someone had a key and came in. It's like, it's a good way to kind of assess programs. But if you can ask questions just to the residents, of course, if you're going up for fellowship, same thing. I think that could be an opportunity. Usually the residents, for the most part, want to give you honest answers.
Yeah, I found it was very helpful to connect with somebody one-on-one if you have the chance. Obviously, I think this depends at how many programs you're interviewing at. So for derm, because I also have to interview for prelim years. And so for a lot of the prelim years, I also talked with somebody individually because I wanted to know, like, I tried to find somebody who went into derm and had done that prelim year to figure out, like, is this something that's going to be generally beneficial? But then if you do know people at the programs, or like oftentimes the residents will have, like, you will be assigned to somebody to, like, if you have questions, you can reach out to this person. Sometimes just setting up time to talk on the phone with them, they might be a little bit candid versus in a formal setting. But I totally agree with Liz. I think watching how people interact, like, are they joking? Are they laughing? Do they kind of know each other? Do they seem like they're happy to talk about the program? That's, I think, really important as well. It is really tough to tell because, like, it's just hard to have a normal social interaction on Zoom. It's just kind of awkward. But as long as people seem like they're getting along and they know things about each other, I think that's kind of the best thing you can take away from it. And also asking questions sometimes, like, how does your program, can you give examples of how your programs responded to feedback? I guess that might be a little bit late because you've already had the interviews, but if they've, like, oh yeah, we've changed X, Y, and Z, then that kind of shows that it's like a positive culture where they're actually, like, listening to the residents and making changes.
Yeah, that's a great point. Thank you. Maheetha, do you have anything to add before we move on to the next question?
No, I think that kind of covers it.
Awesome. And as even Liz was kicking things off, I was thinking back in my mind, absolutely. I was in a fewer than 12 resident program. That's mid-size for ENT, but obviously pretty small compared to average and to medicine. And at the end of our second year, my co-resident overheard one of our attendings asking a chief what her name was. I wish I was kidding. And it was, it was a super, super specialist. Not going to say, what the subspecialty was, but I mean, like.
Spill the tea. Spill the tea.
Yeah.
Whoa, who was it? Who was it?
Oh my gosh. No, Maheetha, you're trying to get me in trouble. But I'm just saying, like, yeah, that's probably exemplary. And the reason I bring it up too is like, I know she mentioned it to me because it made her feel crummy. Pretty understandably. In such a small department. So these things, but that being said, it's like, I know, or at least I'm going to posit my best guess. I can't speak for her, but we've been colleagues for so many years. And I really do think that if you asked her, would you do it all again? Would you go there again? Despite the X and Y and Z and like this man didn't know your name for multiple years of working there, she would say yes. So going back to even some of this, like it all works out. It's like, if you really want to be, a board certified physician in your area of choosing, it's like sometimes we get put where the fates put us. Alrighty. So this is a very, very interesting question from Veronica. She's received some advice from attendings that she should look at doing residency at places that don't have fellows. Do you guys have opinions on that?
So I do. This is a super common thing in plastics because I think there's like programs that have like there's like an independent and an integrated track. Won't bore you all with it, but this is like a common question that comes up. I'm at a program that has like a lot of fellows. And I remember being like a little bit concerned that was going to make my experience worse. And I would say, if anything, it made it way better because it just exposes you to people who are like really excellent, but who have different experiences that they end up sharing with you. And for us, at least, it in no way I've never felt like it infringed on my educational opportunities. Like, I think that's why people worry about it. So I think that's something that, like, looking kind of back to that first question, I'm glad that I did not take that into consideration because I think, a lot of times, like, having a lot of fellows is a sign of a program with really high acuity, really interesting cases and really good volume. And so it doesn't necessarily mean that that's, a zero-sum game.
Yeah, I agree. I think Veronica, Maheetha, you were speaking, I think. Go ahead, please.
Oh, no worries.
No, you guys
worries.
tied that tie. That was not, nobody spoke over anybody. Who truly, thank you guys for bearing
actually,
with us.
Dr. Vater, talk about the medical oncology, like that experience.
Oh, sorry. Laura, Maheetha was asking. Maheetha was like, I'm throwing it back to you, Laura, but I'm sorry about that. That's my job. She cannot hear you. So, Laura, if you don't mind starting us off with the medical side of things, because then Maheetha can absolutely weigh in on Euro. Thank you, guys.
I think, yes, it depends, Veronica. I don't know your field, and if Francis, you know that, please chime in. I think, Veronica, I obviously come from a medicine standpoint. If you are at all thinking about fellowship, then it is really important, I think, to go to a program. Let's say if you want to go into cardiology, you should try to match into a strong medicine, med or peds or whatever you're interested in, that has a strong cardiology program, because that's how you're going to find mentorship and research and all the opportunities. I found, so I'm a HEMONC trained doctor, I think fellows across the board made my internal medicine residency so much better. It was the fellows, the ICU critical care fellows that taught me how to do procedures, central lines, helped me in the middle of the night. It was the fellows who kept me laughing, who would like run to codes eating Rice Krispie treats. I mean, the fellows are just, it's great to see a person that's at that next level of training if you're interested in fellowship. And I will let Maheetha give the surgical perspective.
No, I think thank you so much, Dr. Vater. And I want to point out how the perspectives of like a surgical perspective on this and a medical perspective on this is different. And I think that's important for folks to note, because I think having a fellow in surgical specialties means something different than having fellows in medical specialties. So I have a more like nuanced take on this, which I agree with Liz that a surgical program like urology, having fellows indicates that they do high volume and they have a lot of volume to support a fellow and they have the complexity of cases to support a fellow. However, I do think there's a little bit of the ratio of what the fellows to like the residents, I do think kind of matters. And also the ratio of fellows to kind of the number of operating rooms does matter a little bit, because when we talk about this in a urology space, we talk, well, are the chief residents getting to first assist cases? And it doesn't matter if that means that the chief resident is first assisting with the fellow and they're doing the case together, right? And that's kind of where what you need to ask is like, when a program has fellows, are the chief residents assisting the fellows, and are they getting to do the case together? Or is it mostly the attending and the fellow doing the case together, and you are kind of second or third script? That doesn't matter if you have 8 ORs going for like very complex cases, and then the fellow's just doing one of those ORs, and then you get to do the other OR. So there's like a little bit of nuance in how you ask, and what the vibes are, because our program has fellows and they're incredibly well trained. So it's mostly the fellows and the residents that are doing cases together. But I know that there are a lot of other urology programs that have this fighting between the fellows and the residents as to like who gets to pick the case and who gets to first assist the case. And there's a little bit of tension there. So I think that those are some nuances that you kind of get to learn and ask about ask the residents on the interview day. Like, oh, like what does your relationship with the fellows look like? What kind of cases do you do? So.
And I think it's like a good thing to ask in surgery, at least the residents about. I wouldn't ask the faculty about it necessarily,
Right.
because their opinion, they don't know, first of all, and also like it makes it sound like you're have a concern when anyway, only the residents are going to know how that actually is.
Totally agree. Yeah, you guys covered that very well. That was my experience. The attendings just wouldn't know, especially the attendings who don't.
Yeah.
Yeah, if they don't have a fellow, and then even the attending with the fellow, they also are not necessarily keeping track of all of this stuff. I wanted to just augment what Maheetha said about, how some of those cases go, because at our program, so for ENT, we just had an otology fellow. So just one fellow, and it was only in otology. Interestingly, they didn't have that at all when I started. So that fellowship was created while I was there. This goes back to you guys, like, you could have made the perfect rank list. I mean, there can be new fellowships created while you're somewhere. So you can do your due diligence and still unexpected things will happen. Just kind of preparing mentally for that. But even as other people look at that program, it's where if you want to be a general ENT or specialize in anything other than otology, that would actually be a plus, because our fellow in otology, they did do a lot of the case. To Maheetha's point, they definitely were kind of first assisting the attending. And so for those of us, myself included, who did not have an enormous interest in ears specifically, it was kind of a positive. But certainly for some of my co-residents who they wanted to either do an otology fellowship themselves or they wanted to do general with a lean on ears, kind of a bummer. That's a tough hand to be dealt. Okay, wonderful. So this is an interesting question from Julia. I am at a point where I'm torn between 2 specialties. I may apply to both. I wanted to ask for advice on how to thoughtfully rank programs across specialties if that situation arises, and if there are pitfalls I should avoid.
I can start. I did kind of dual apply-ish. So I want to be a pediatric dermatologist, and there are a lot of pediatric dermatologists that did pediatric residency and then derm residency and then fellowship. So I was like, you know what? It is less competitive to match into pediatrics than dermatology. So I could apply to a few peds residencies kind of as a backup plan. But I knew that I ultimately, either way, you still have to do dermatology residency. So, and I also would still have to do that prelim year. So that would be adding 2 whole years. And it is kind of harder to find, sometimes the places won't take you just because of funding and whatever. So I only applied to 4 programs at places that I was like, I know this area and I have a connection with the program from doing it away, or it was my med school or blah, blah, blah. And I knew that they had a strong derm and peds derm department. So I was like, if I did end up having to be in peds residency, I think I could still be happy there. And I could use that location where I know they have peds derm to build that network. And then hopefully it would help me match into derm residency. So I kind of dual applied as a backup plan, which a lot of people in derm do. But I think it might be different if you're trying to decide between the 2 specialties, because it would be probably really hard to rank comparing both program and specialty across them. So I can only speak to my experience where it was more of a backup plan kind of. But
essentially I ended up putting all the, like, I think it was helpful to just have interviewed and applied there because you can't go back and do that again. However, you could always change how you rank them. So I ended up deciding at the end, I was like, you know what, I think I would rather do my intern year and then reapply rather than be stuck in the 3-year thing and then have to reapply. So I ended up ranking them at the bottom. For derm, anesthesia, PM&R, and radiology, you have to do your prelim year first. And so for that one, I also applied to pediatric prelim years, internal medicine, and transitional years. So I guess those are kind of like different specialties a little bit. So for those ones, I did compare both like location and the program and the details of the program, and then also comparing them to like the advanced derm program, like in terms of like, will I have to move, vice versa, those kind of things. So I feel like there's a lot of different things to think about when you're comparing between specialties and programs. So that's kind of my experience with it, but I don't know if it exactly is quite the same, but I don't know if that's helpful. I
Yeah.
hope it is.
No, that's helpful. Thank you, Andrea. I guess my next question would be, does anyone have any thoughts? Can anyone speak to, I think that what's interesting, and certainly please feel free, Julie, I believe, who asked this question, Julie, if you want to weigh in and say what the specialties are, like that might impact what some people's advice or initial thoughts are, because my immediate question, what arises is there sometimes a little bit of politicking? Like, I think in ENT specifically, the only thing I can speak to, if they see ENT with like family medicine, then they sometimes find those to be such dissimilar types of fields to go into that it raises red flags or it raises questions. Oh, okay. Thank you, Julia. So Julia shared OB-GYN and psychiatry with an interest in reproductive psych.
That's
So
very cool.
Very cool.
I also will say that I don't think they have to know that you're applying to both unless, like, I didn't tell anybody that I was, because some people did say similar to what you said, that if people know you're applying, then the more competitive one, like the one you really want to get into, may be like, oh, you kind of have a backup plan. Maybe you're not as serious about this. So you don't necessarily have to tell them you're doing both. But if they are at the same place, I don't know. I don't think they should be talking between departments, but I guess I can't say that they wouldn't find out.
Yeah, I think you should just be really honest with like, just again, like kind of, you have to, I don't know, I believe with the match, you have to trust the like Nobel Prize winning algorithm that does this. Like, just like let go and accept it. And so look at your list of things and just be like, would I rather go to this one or this one? And just treat it all like A, B, A, B, and just make your list that way. And then, I don't know, just like maybe the algorithm will put you where you're supposed to be. Like, if you're truly not sure which way is the like best approach to this field, just rank, either or, and see what comes out of it.
but
I
I
guess.
do.
Oh, go ahead.
Oh, yeah. No, go ahead, please, Andrea.
I was just going to say, if there are any places that do have people that specialize in reproductive psych or that there's fellowships in it, then I would probably prioritize that. And you could even ask those specific people in that field, what do you recommend? Again, you can look at what background they did. Like, are they mostly psychiatrists or are they mostly OB-GYNs? Did any of them do both? Because if that's your goal, it might be helpful to see what other people who are doing that have done. Because if you're going to be like not able to do research or get opportunities to do that, then it might be kind of, you might feel like you might have wished that you did maybe the other one. So that would be my advice to see.
Yes,
Yeah.
I would say too that, Julie, I think that the hardest thing to do, and I kind of forced myself to do this when I was in your position, is even when I was thinking about fellowships, do I want to cath people all day? Do I want to I was really interested in preventive cardiology and hemonc. And so I was really kind of torn between the two. And I'm sure you've done this. You've spent time with both of these specialties. And I would think, do you want to be like delivering babies, seeing those moms postpartum, following them long term and supporting their mental health, but also doing their pap smears and this, the surgical side of things? And do you love the surgical side? Because the OB-GYN path is like tons more sleep deprivation, tons more potential for, I'm sure, those of you who are surgeons in the room, right? Not that psychiatry is an easy path, but there'd be a way to very easily carve out, as a reproductive psychiatrist, that path. And if operating and doing procedures and being in the operating room with women is like, that has to be part of my career. I guess I would love to defer to the other surgeons here, if you would agree with that or not. But that might just be one way of, when you think about your career when you're done, how would you be spending your time? Would it mostly be talking with women, prescribing them medicine, supporting them through what they're going through? Or would it really be just as operating really part of that? I'm sure you've probably already thought this through, but that just might be another way to ask this.
No, I love that. And thank you, Maheetha. Maheetha is very good at multitasking. She'll just be like firing off in the chat. She can do both. I think some of us are maybe like a little half a generation older and we're like, okay, let me see. So thank you, Maheetha. Definitely to Laura's point, I agree that the first branch point is you're describing something where one is a surgeon. OB-GYNs do identify as surgeons professionally, and then the other one isn't. And Maheetha shared here that she told urologists, my backup to this is if I have a backup plan, like I would be a doctor and I would practice medicine. I myself am one of the few surgeons that I know who ever really loved clinic. I always did. And certainly in my last few years of practice, I loved clinic. That's the thing I miss. Occasionally people say, do you ever miss the OR? I don't. I really liked clinic. And so it's interesting, I think, breaking it down that way. I don't know, Liz, the surgeon versus non-surgeon pathways, do you think
It's
that they
very
really
different.
diverge?
Yeah. I mean, it's very, I think another way to think about it would be like, say you cannot get whatever amazing job you want in this specific niche and you have, or like for some reason you have to like move home to your parents or something, like so something happens and you have to pick a job that's not exactly what you want. Do you want that job to be general OBGYN or general psych? Just because I think it's like important to think about the skill set you're going to have through your entire life. And I would agree that it's very like the lifestyles of the psych residents and the OBGYN residents that I know are very different. So, I think there's a choice to be made there.
Amazing. Okay, well, we have some questions popping up here. I want to, I think that this is relevant. Matthew has asked something about HEMONC, so I'm going to go ahead and read it, and we definitely want to give Laura the floor. But as someone who wants to subspecialize in combined HEMONC, there's something that I'm having a hard time deciding between when it comes to ranking programs. The thing that makes me torn when choosing a program is choosing between one that has great global health, culinary medicine, other things that would make it a great experience, but they don't match many fellows each year, compared to a program that doesn't have those things, but they match many, many fellows and have a wonderful culture. Any advice on how to approach what would be the most advantageous when trying to eventually get to HEMONC?
So it sounds like it's hard for me to tell, Matthew, if you're like at the internal medicine juncture, then you're like planning ahead to HEMONC. But I guess I'll just answer the HEMONC question is that, I think that when you envision your future life, if global health or culinary medicine, if it's like that is the thing I'm going to do, then it's going to be really important that you go to a I'm here at IU, and Pat Lair, created the AMPATH consortium and, the Kenyan, Moi University program. And so it's like, he's like the national leader in global oncology. And I think looking at maybe making global oncology your number one, and then looking at multiple different programs for global oncology. If you think, hey, I'm going to be spending, just like here on my campus, I've got oncologists that spend 2 years here in Indianapolis, but then spend 10 months out of the year in Kenya or other places. If that's what's most important to you for your career, then perhaps that should be the priority. If it's like, well, I'd love to do some culinary medicine, I'd like to do a away global health rotation, I'd love that as part of my culture, but that's not necessarily the thing that I'm going to really have as the center of my career, then I think that when you're a trainee, having a good culture, having support, right? I mean, I think that is of high priority. And so I hope that gives you a little bit more insight that if those things are like non-negotiable items, then I think you have to go for that program that has kind of everything you want. I'd love to hear if others have thoughts on that. And I can also maybe message personally here too.
No, that's great. Matthew, let us know if you have any, follow-ups there, but I think that it makes perfect sense. I want to, in the meantime, I think that this question that Liz is engaging in the chat is very helpful. It is really about, deciding between a program that seems more supportive and better culture versus, I apologize. I got all mixed up. My old eyes. Where'd the question go? Well, it's fine.
It's right
This
above.
question that I thought was really great was about like location versus program. Everyone's experience with that and how things worked out for them. And Liz, I'd love if you don't mind sharing really quickly, like for all of us
Yeah,
in
sure.
studio, that would be great. And then hear from everyone.
For sure. So this is a question that I have, I'll expand slightly more, which is that I did consider geography in a small way, and that I have my husband who needs to come with me, and there's like 100 something plastic surgery programs, and I was like, I'm not going to apply to all of them. Like I said, I gave him the list first, and I was like, just identify half of these programs that are places you don't want to live. And luckily, like for us, like there were not very many like super excellent programs that I was losing the opportunity to like go to because of that. Because it's like a lot of our great programs are the Northeast, and that's where I wanted to be anyway. So anyway, that's the only geographic consideration I had, is like I only applied to programs that were places he was willing to move. And then within that, I felt really strongly like, med school doesn't, like, med school is kind of all the same. Like you learn the same stuff, you're taking the same step exams, like that. For med school, I think it matters more like where do you want to live, like where you want to be happy, where's your support system. When it comes to residency, especially now that I'm in my chief year and looking like kind of like looking ahead to actually being in this job, it's really important to me to be able to like in the bad moments, especially like that I'm going to have, I know in my future, be able to say, like I like have really excellent training, the best training that I could possibly have. I gave it my all, and I like gave everything I had to try to help this patient. And like, yes, in medicine, things don't always work out, but to me, it was really important to think of like residency is the actual set of skills you're going to use every day. And so you should try to get like, that's the money. That's where things really matter. And so for me, I was like, I'm going to go to the best program I can possibly get into. And if it's a city I've never been to, like Philadelphia, like we'll figure it out. And now if you know me, I'm obsessed with Philly. And so, again, that's that thing of like, life puts you where you need to be sometimes.
I would like to add on to that. And I think there's like 3 questions that were asked in the chat that we can like kind of lump into one.
Yeah.
Because one asked about like location versus quality of program. Another one asked culture versus fellowship opportunities. And the third one was like, is there anything you would rank that you considered, but it's not really that important? So I'm going to try to answer all 3 of those very succinctly. I really agree with Liz on program versus location. I do think that this is your moment, like your residency, this is your job. This is going to be your job forever. This is the moment where you get to really put in your all and become the best that you can be. And I think that I hands down would choose a program that had higher quality over a program that was closer to home. Because in the end, like it does kind of matter, like the opportunities that are presented to you, the kind of cases that are presented to you in residency do influence like, what you get interested in and what kind of, what kind of cases that you see that can train you better to see certain things in the future, right? A common thing in surgery is, am I going to be well trained enough to be able to just graduate and do something and get a job, right? Like that is something that I think actually signals the quality of a program, is if people are graduating and they're just getting jobs and they're able to do whatever they want to do, then that signals that they don't really feel this need to get extra training and extra fellowship. But at the same time, if a program is matching people to fellowship and some of them go general and some of them go fellowship, I think that is also a good sign that they still have the quality and the research and opportunities to be able to look good for fellowship programs. Now, fellowship opportunities versus culture. I'm going to say this, and I really mean it, is that every program is going to have pros and cons. Every program is going to have things about their culture that you like and things about their culture that you don't like. However, there is a vibe that you can get from talking to people about, oh, this program, like overall, people feel horrible. Overall, people feel great. And so you'll notice that like the top programs generally have this same vibe of pros and cons. Like they just have different advantages and different disadvantages. I think it's hard to survive in a program that doesn't have good culture. I think Frances can talk to this. Can she's the spokesperson for this, but I am really fortunate to be at a
Virgin on the
program.
Edge, coming February 20th.
Read it, buy it.
It's
my
great.
God, you guys
It's
are
really
so
great.
nice. Yeah.
So I will say that it is hard to survive and do well in a program that has a really horrible culture. It's hard. It is going to make your life harder. Versus fellowship opportunities, like if there is a culture that supports you, you will be able to find those people. They'll be able to connect you to those people that you need in order to do fellowship. Now, is it good to have fellows at your program and people who have fellowship? Sure. Is it necessarily like a death factor in your ability to match to fellowship? Absolutely not. So that is one thing I would say to answer that question. Things that I thought mattered that don't really matter for me right now is I think that the nitty-gritty of the kind of city. So like I think anything from like a medium to a big city that has access to an airport, that is what I want, whether it's like a medium town or like a huge big town. In the end, you're going to be spending a lot of time in the hospital. That is what you're going to be spending. That's where you're going to be spending your time. So, some people are like, "Oh, I want to live in a big city." It's like, yes, but also let's think about how much you weigh that in versus the quality of a program, culture, and fellowship opportunities. So that's what I will say.
Yeah, I echo a lot of that. I think for me, I struggled with for prelim year a lot balancing location versus like the program just because it was only 1 year. So ultimately, when it came down to it, I was like, is it really worth moving 1 year for something that's not the specialty that I'm actually doing? Like, I really wanted to do a pediatric prelim year because I want to do peds derm, but so many people were like, you don't have to do that to be a pediatric dermatologist. Like, you're still going to learn everything, which is very true, even though I really did miss seeing kids. So I ultimately decided to stay where I was, also because my at the time boyfriend, now fiance, wouldn't have been able to move with me. So I thought that having that support system would be really important. And I think it worked out for the best for sure. I think it was like, I think it's also important for prelim years, if there's anybody who's out there, to make sure that you're going to be somewhere that has like a decent balance of like not being too overwhelming. Again, for something that you're not going to do, it's not worth being like dying every day, being super overwhelmed. Like there's going to be times that you're feeling like that, but overall I'd say like you don't need to be at like a super major like tertiary top tier medical center for your prelim year. So for prelim year, maybe location, as long as the program is generally a good culture, like you also don't want to be hating your life and hating the people you're working with for a year. But if they have a good culture and it's between location, then I might think about location. But I totally agree with Liz and Maheetha that for like your eventual like total residency, I think that having a supportive culture and feeling like you're getting the best training and you're going to be prepared in all the aspects of your field is really the most important thing. Same with fellowship. Like people can match into fellowship even if they don't have fellowships at their program. And I think it could even work the other way too. Like if you have a really negative culture, it's also possible that they could make it harder for you to match into fellowship because maybe people are just being really nitpicky about something that you did that wasn't wrong. So I feel like it doesn't necessarily mean that you're going to match in fellowship just because they have it if they don't have a good culture. I think being somewhere that has a good culture, people are going to be supportive and they'll connect you and you will be able to find a fellowship, and prioritizing the culture and the learning opportunities would be what I would recommend as well. Yeah, I never remember looking at the doximity ratings, so I didn't even know that was a thing. I definitely agree, like trusting residents and vibes, maybe asking them about like cases that they're doing. Like, I don't know if for other specialties, but for like dermatology, we have like case logs that we have to do. And so I feel like asking people like, oh, is it hard for you to meet your procedure case requirements? Like, do you feel very well prepared in the procedural aspects, and just asking them about the different aspects of the field and stuff that are priorities to you? That's probably the best way to know.
That's great.
Yeah,
Thank
don't
you.
base any of your decisions on what doximity says.
No, no.
No.
That's bad info.
It like vibe coded it that way.
It's
I
like
think
it's
I
from
just
before vibe coding. It's going to be replaced by vibe coding any day.
yes. Well, Laura, I'd love to hear if, like, especially this question of, is there anything that you thought was a big deal back in the day that in hindsight you don't feel the same anymore about?
Good question. I will speak to my fellowship. I ended up staying at the same place where I did med school for residency because I had a 1-year-old daughter and it was a great internal medicine program. And then when I was looking for fellowship, I applied really broadly and I got to interview at some really top Ivy schools and, all over the country. And I felt like, oh my gosh, now I'm a fellow and people want me. And I was like, it's like a cool feeling, right? To be at these top programs and them to be like emailing you and wanting you to come. And I don't know, I feel like that's more in fellowship perhaps than residency because the field is smaller. And so then I was kind of on this high coming back from this. I did like 5 programs in like a week and a half and came back home to my husband and my daughter who were at home. And you know what? The program where I am, IU, like the fellowship is just like one of the oldest programs in the country and just really well known. And I'm thinking, am I making my rank list because of the name, or am I making it because of where I really want to go and where I'm going to be really well trained? And so I had, this kind of couple week period where I was like, what do I do here? Because there's some of these programs that are incredible and how cool would it be to train? But at the same time, it's like, does it really make sense to uproot my daughter from her family, all of her cousins, her grandparents, my husband's job, sell our house, move across basically for a name? I didn't feel like the training was going to be any higher level than what I was going to get at my home institution, where I already had incredible mentors and kind people that had, that really wanted me to stay. And so ultimately I ended up staying at IU, and I had an incredible training and support, and I got hired on as faculty. And, some people have the flexibility more so to move across the country. Others, for whatever reason may not. But I ended up making a decision that felt like it was the right decision for like my life beyond medicine, but also my life within medicine. I felt like I got great training, but I think that, and when I was in it, I was like, oh, I need the name, I need the pedigree, right? And I'm sure I support, if you're in a position in life where you're like, that's what I'm going for, I support you 100%. But I also think just taking some time thinking, where is my support? Am I going to get excellent training? Am I doing this for the name or what I think it's going to be, or for what really it feels like it's going to be? And then I think for me, it was some humility of just like, this is really where I want to be. And I don't care about that one line in my CV when it really comes down to what's most important to me and my values. And I think that's different for all of us at different seasons in life, but that's my 2 cents on that.
1,000,000% retweet what Laura said. I know a lot of people who chose prestige, and then when it isn't a good fit, they have regrets. Versus often when people choose based on values, I anecdotally don't see as much buyer's remorse, things like that. I think that I really liked this question from Sophia, because here I think that it's an invitation for us to have this values conversation and maybe for everyone to weigh in. Sophia said, if a program gives you slightly off vibes during an interview, how much should you trust that feeling, particularly in a virtual interview setting? Thanks in advance. The reality is that, especially, and I experienced this in ENT, when it's, the way residency and the match is set up, you do have to decide, would I rather not match or match at this spot? Where, like, obviously you're going to get different vibes from different spots. And for instance, I did 17 interviews and I ranked 16 spots. There actually was one spot that it was so off, vibes were so beyond off that it was like, okay, we really talked about it. Plus, speaking to the husband effect, my boyfriend at the time really did not want to go to this city. It was hours and hours away from an airport. So it was like combined bad interview experience with very far from an airport things that we would want in our life. Do any of you guys relate to that? And just this question of, you need to know if you're going to feel good about it. Would I rather be there than be nowhere is almost a way to game it.
Yeah, I think in Durham people say that a lot too. I mean, when I applied, it was different from now because it was like the first year where they had this signaling thing. And so for Durham, we only had 3 signals. And nobody knew like which programs are looking at the signals. Do they even care about the signals? What's the point of these signals? I don't know. They were kind of dumb. But now I think they've changed it so you get a certain number of like silver signals, which are basically saying like, I'm like really interested in your program, and a certain number of gold, which is like, I'm super interested in your program. So I think that helps you to choose where you actually get an interview more, which is great, because I felt like some of my interviews, I was like, I've never been to this state. Why are they interviewing me? That's so random. But when I was choosing where to apply, I did think about that. Like, would I rather not match than go here? And for most of the places, I'm like, I would rather still match and be a dermatologist, except a few of them where it's like they only have one resident and they're in the middle of nowhere. And I'm like, I don't think I would enjoy that experience. So I think the same kind of goes for ranking too. Like there was one prelim program that I also didn't rank because the vibes, I was like, this is not good. So I think if you were like, this would not be a good experience and you would rather not match than be there, then you should not rank that.
Agree. I ranked everything in my list. I think it was 22 programs. But I would have probably been severely depressed at the ones that I ranked as 21 and 22. But I would rather have matched than go unmatched, because being a reapplicant in urology is not ideal.
Yeah, same is true for plastics. Like I ranked everything, even though there's one program that I was like truly thought was horrible. But it's easier, like, and I know people who this has happened to. I have at least one person who graduated from my med school who like ended up at some like really low tier program, and then they closed that program and they ended up somewhere awesome. So like I don't know, the future's uncertain with this stuff. Like, but you're always better off coming from inside the house than outside the house. So
Yeah, well said. I know we have a couple minutes left. There was one question that was written in ahead of time from a gentleman who was like, can't make it live, but please, if we can hit this question. It was actually about couples matching. And just kind of that's something we haven't touched on this evening, so I'm not trying to open a whole can of worms, but if anyone can speak to whether it's one of their colleagues or, just any advice that you have for approaching what's going to be fair and measured and how to weigh that extra wrinkle in the approach.
did anybody hear couples match? It seems really hard. Everyone I've talked to about it just seems like really, really hard, like wrenching decisions
Oh, yeah.
that you
Also,
could decide like if like we can't both be together, then like who do we want to be, like how far? And it can go like awry. Like there was a couple that matched, I think the year after me, that ended up on opposite coasts, and like it's because it's still they would have preferred that to not matching.
Are
And
they still
this
together?
field, I don't know. It's a great question. I don't know.
Oh,
I didn't follow the
okay.
story that long.
Maybe
They were
not a
not
happy
friends. They
ending.
were just like people. It was like a legendary story of like, oops. But it still counted like as a couples match, and that they ranked that, because you have to rank like all of the possible combinations. So like they just fell far enough down that they ended up on a combo that was like the two of them very far apart. Anyway.
yeah, I also had. Okay, I was going to bring up what Maheetha said because actually one of my co-residents is a dermatology resident and her fiance is in urology. So because Uro and Optho have a separate match, you can't actually do a couples match. But the nice thing is that those specialties do find out their match earlier. So then what she did is just like email the program that her fiance matched at, which luckily she had interviewed at. I think it would have been tough if you didn't already interview there. And then she was like, hey, like my fiance matched here, so this is my number one program, and it worked out. But I think if they don't prioritize that, then they probably don't have a great culture, because like if you're like my fiance or whatever partner matched here and like they're not willing to take you, that's kind of bad. But it's not like that obviously it's not that easy. I will also say that you can't couples match for prelim programs, which I learned because we had two couples in my prelim year and they were all like, we're so grateful that we matched here because you can only rank couples match the advanced programs apparently, which I think is not great. So they also just had to email the programs to be like, hey, we're couples matching, like this is our number one, like please take both of us together. So that's definitely not fun. And I had some friends that couples matched in like IM and things that everything was categorical, but even then it was like so hard because you're figuring out like proximity versus program and like what happens for one person. It just seems like a total headache and nightmare. So like good luck to anyone doing that. I'm
Yes,
sorry that
all
you
of
have to
my
go through that.
sympathies and like good
Okay,
feelings.
our
and
sympathy
sorry
and
that-
good luck,
best of
well
luck.
wishes from
Someday
from
someone's
us.
gonna invent like a teleporter, and then none of this will matter. But until then, we're all stuck like this.
I do think I want to call back to Laura's point about values. I think that is the correct answer to most of these questions, which is that if you know yourself and you know your values, then you can feel at least good about whatever ends up happening on the back end. Like Liz mentioned this couple that she knew where they did go through the process. They did choose, we are willing to live on separate coasts if it goes that far down. And so as long as that call that they made was in line with their values, then even though that's pretty brutal, that's a very long flight, hopefully they could feel good about it. Good. As good as you could feel about it.
Yeah.
We'll put it that way. And then may I ask, Andrea, did you drop oh, you did. Perfect.
Yeah.
Everyone has dropped their info. I see. You beat everyone else. Great. Thank you all for being here. I know that we just have to be respectful of everyone's time, so we have to wrap up, even though I think we had a lot of incredible discussion this evening. Thank you for joining us. Thank you so much to our panelists for being here. You guys were amazing.
Thank you for
Thank you
hosting
to Lewis
breakfast.
for being here
thank
as
you
well.
so much.
Good luck to
Best
everyone.
of luck, everyone.
Rooting for you.